Birth and initial steps. In this video, we will show you what to do after birth and initial steps. Baby is born. Note the time of birth. Time is 10:30 a.m. Receive the baby on warm towel and keep on mother's abdomen. Turn head on one side. If there are any secretions from mouth and nose, then wipe it. Dry the baby thoroughly. Discard wet cloth. Assess whether baby is breathing or crying.
No, baby is not breathing.
If the baby is not breathing well, provide initial steps. Immediately cut the cord and take the baby to radiant warmer. First step of initial step is position the baby. For positioning, the baby should be lying on the back with the neck slightly extended in the sniffing position. To attain correct posture, if there is swelling in the back of head due to molding, edema or prematurity, then use shoulder roll to attain correct posture. Second step of initial step is clear the airway. For clearing the airway, first do suction from mouth, then nose. During suction from mouth, the insertion depth should not exceed 5 cm beyond the lips. During suction from nose, the insertion depth should not exceed beyond 2 cm. Remember, deep or prolonged suctioning may lead to bradycardia. If you are using suction machine, then the pressure should not exceed 80 to 100 mm of mercury. Do not suction for more than 3 to 5 seconds. Apply suction while withdrawing the tube. Third step of initial steps is to stimulate the baby to breathe. To stimulate the baby, gently rub the back of the baby once or twice. Remember, some older method of stimulation like slapping the back, shaking the baby, squeezing the rib cage and forcing thighs into abdomen are dangerous and can harm the baby, and they should not be done anytime. Fourth step of initial step is to again reposition the baby as described earlier. In this video, you learned the 4 steps of initial step. First, position the baby. Second, clear the airway. Third, stimulate the baby. Fourth, reposition. If the baby is breathing after initial steps, then the baby should be kept in observational care with the mother. During observational care, place the baby on mother's chest. Cover baby and mother together. Initiate breastfeeding. Monitor neonate. Temperature, heart rate, breathing and color to be monitored every 15 minutes in first hour and then every 30 minutes in next 1 hour. If after providing initial steps the baby is not breathing, then start bag and mask ventilation as shown in next video.